Hello everyone, this is Sumant Raj from RV Dental College. Today I am going to talk about oral health hygiene for pregnant women. Pregnancy is a unique time in women's life, accompanied by varieties of physiologic, anatomic, and hormonal changes that can affect how oral health care is provided. However, these patients are not medically compromised and should not be denied dental treatment simply because they are pregnant. Now I am going to discuss about the normal changes associated with pregnancy, general consideration in care of pregnant patients and possible dental complications of pregnancy and their managements. Maintaining a oral health during pregnancy has been recognized as important public health issue worldwide. Oral health is an important component of a general health that should be maintained in pregnancy and throughout the lifespan. Now we are going to talk about whether the pregnant woman can take a treatment while she is pregnant or not. Before that, we will see what are the common things seen in the pregnant woman like gingivitis, enamel erosion, xerostomia, tooth mobility are seen. These patients have a heightened awareness of sensitivity to taste, smell, and environmental temperature. Unpleasant taste and odor can cause a severe nausea or even vomiting, and overeating can lead to a fainting. On a dental part, the dental staffs and control of the office environment to an extent possible will contribute to the patient's comfort and sense of well-being. Coronal scaling, polishing, and root planing may be performed at any time required to maintain a oral health. However, routine general dentistry should usually only be done in second and third trimester of pregnancy. Organogenesis is completed by the end of first trimester and uterine size has not increased to extent that sitting in a dental chair to uncomfortable. Oral radiograph is safe in pregnant patients. Provide protective measures such as high speed film, apron, and thyroid collar is used. There is no increase in congenital anomalies. Periodontal disease is usually appear in the first trimester of the pregnancy. This form of gingivitis results from increased level of progesterone and estrogen causing a exaggerated gingival inflammatory reaction and local irritation. The interprox become red, edematous and tender to palpation, and they bleed easily if subjected to trauma. In some patients, the condition will progress locally to become a pathogenic granuloma or pregnancy tumor. Tooth mobility is a sign of periodontal diseases caused by mineral change in lamina dura and disturbances in periodontal ligament attached. It is mainly due to the vitamin C deficiency. Odontogenic infection should be treated promptly at any time during pregnancy. Although pregnant patients are usually not immunocompromised, the maternal immune system does become suppressed in response to fetus. Their concern is prescribing and administration of drugs. The most obvious concern is that the drugs will be cross the placenta barrier and cause a teratogenic effect to the fetus. Example, acetaminophen, which is a pregnancy risk category B, is the safest analgesic for use during pregnancy. In case of antibiotics, except tetracycline and the derivatives of tetracycline, which are the main drugs which causes a teratogenicity in the fetus, mainly on the developing teeth and the bone. Other than this, like metronidazole are fine with the pregnant woman. Fluoride treatment may be needed for a patient with severe gastric reflux caused by nausea and vomiting during early pregnancy, which can cause erosion of tooth enamel. In this case, fluoride treatment and restoration to cover the exposed dentin can diminish the sensitivity of and injury to the dentition. Topical fluoride gel may cause nausea, so applications of fluoride varnish may be better tolerated. Barbiturates and benzodiazepines should be avoided during pregnancy. The greatest concern for patient safety during administration of nitrous oxide analgesic is the potential for hypoxia. Optimal oral health is very important for pregnant patients and can be provided safely and effectively. Paying attention to the physiologic changes associated with the pregnancy Using careful radiation, hygiene measures, prescribing medications on the basis of drug safety categories and timing appointment and aggressive management of oral infection approximately are important consideration. Possibility that periodontal disease may affect the pregnancy outcomes. uh, the dentist needs to play a proactive role in a maintenance of oral health of pregnant women.